Hey guys, welcome back. Today I wanted to introduce you to the topic of leg length discrepancy, tell you why this is such a crucial component to getting people out of chronic pain, and give you some tips to help you identify if you're dealing with a shorter leg. Now, leg length discrepancy is essentially having one leg shorter than the other, and research shows us that up to 60% of people are dealing with a leg length difference of 5 millimeters or higher. Now, only about 10% of people are dealing with no leg length discrepancies. That means that up to 90% of people are dealing with a leg length difference. Now, a 5 millimeter difference can be a source of significant pain, but we have patients that deal with chronic pain that have less than a 5 millimeter leg length difference. That depends on how well their body's able to adapt. Now, in the description, I've linked research that backs up what I'm going to cover today, as well as a video by Paul St. John that goes into more detail about how we treat this condition. Now, why is this important to you? The odds are that you're in that 90%. And when you're dealing with a leg length inequality, the body has to make adaptations for that difference. This can be seen as a scoliotic pattern of either an S curve or a C curve depending on the size of the discrepancy. It can also be seen in pelvic tilts, rotations, torques, flexions, or any combination of these distortions in order to deal with that shorter leg. These distortions are going to go up the postural chain, affecting the spine, shoulders, and cranium, as well as the hips, knees, and ankles, creating muscle imbalances. And eventually, the uneven pressure and forces can create pain, weakness, and damage to all of the structures involved. If a leg length discrepancy is present, it must be addressed in order to overcome these destructive pain patterns. In my case, it was a bulging disc and neurosomatic therapy that helped me identify a 6 millimeter difference. I recently treated a 39-year-old active duty Marine who was strong and healthy but had been dealing with low back pain, restricting his mobility and affecting his quality of life. He had even seen a specialist to consider surgery to fuse his spine because the compression of the spine to one side had led to a herniated disc. Now, in his case, I found a 10 millimeter leg length difference. Now, that's a significant amount. I treated the muscles that were short and tight, and he experienced immediate relief. He reported that he had more range of motion, and that was just in one session. As we continue treatment and correct the discrepancy, he's going to be able to be pain-free and avoid more aggressive interventions. Something so simple but so overlooked was the answer to his pain. Now, how can you tell if you have a shorter leg? Here at the clinic, we take standing and laying down measurements to help us identify if you have a structural leg length discrepancy. If we identify one, we send you out for an X-ray to confirm and get the exact measurement. Then we can discuss how to correct to give you long-term relief of your symptoms. Now, if you're at home and recognize any of these patterns, you may be dealing with a shorter leg. If you look in the mirror and notice that one shoulder is higher than the other, or if you look directly ahead and notice that your head tilts to one side. Now, these can be accompanied with or without pain depending on your health, your age, and how well your body's compensating. If you notice that you shift your weight to one leg primarily, or maybe when you're walking you notice a little bit of a drop off, maybe your doctor or your chiropractor has once told you that you had a shorter leg, but no action was taken on it. You may also be dealing with chronic knee pain, low back pain, or hip pain without a clear explanation for it. If you're dealing with a bulging or herniated disc, or a scoliosis that's considered idiopathic, these can all be signs of a shorter leg. It is extremely important to address these conditions to preserve the health of the spine and joints and to restore the body back to balance. Give us a call and let us help you finally be pain-free. If you have any questions or comments, leave them below. And if we've helped you with a leg length discrepancy and you'd like to share your story, we'd love to hear from you. Take care and remember that education leads to empowerment.